So I will be talking about integrated testing for HIV, hepatitis, and STIs. And I will take point of departure in the EU-funded joint action called Integrate, and some of the related and preceding projects that have been working and focusing on testing. A few brief background slides. So the reason for the continued focus on testing is that we are still not doing well enough. There's little improvement in the number of late diagnoses and in the number of undiagnosed across Europe, except for some recent trends among MSM that were also highlighted in the PrEP session, where PrEP, of course, has had an effect, but where effective testing programs are really the key. So we also know that policies are not always implemented in practice and that we are not always targeting the right population groups at risk when designing testing programs. So this slide shows how extensive testing is being performed in a country among blood donors and pregnant women and with little effect, low positivity rates, while the population groups at risk are not reached. We have a large number of undiagnosed hepatitis B and C, as also mentioned before today. However, monitoring of hepatitis is very limited. And for STIs, there's no sign of improvement either. This slide from the ECDC is showing the increase in the number of reported cases of gonorrhea, syphilis, and chlamydia from 2013 to 2017. So in 2017, the EU Commission issued a policy on integration of disease areas. One of the outcomes of this policy is the Integrate Joint Action, which has the overall objective to increase integrated early diagnosis and linkage to prevention and care of HIV, viral hepatitis, TB, and STIs. It has 29 nominated partners and is covering 15 countries and is running until September next year. So Integrate focuses on how effective tools for diagnosis and linkage to care in one disease area can be used in others. Many of the interventions take point of departure in HIV tools to increase earlier diagnosis and linkage to care and treatment, and is expanding on lessons learned from previous European projects. So the ECDC also recently published the first European guidance on both HIV and hepatitis B and C testing. The ECDC guidance takes a setting-based approach, which is very important for implementation. Also, the HIV in Europe initiative that has focused on earlier diagnosis of HIV since 2007 changed its name to Eurotest in January this year and has organized HIV testing conferences since 2014. This slide from Daniel Simões and GAT in Portugal highlights why integrated testing is such a good idea, showing the overlap in disease areas in people visiting the community testing centers in Portugal and the lost opportunities had integrated testing not been provided. So if you had only tested for HIV. One of the focus areas in Integrate and also highlighted in the ECDC guidance is integrated testing in healthcare settings. So primary healthcare and hospital settings when people are in contact because of other health issues and could with benefit be offered an HIV test. For instance, by focusing on offering testing routinely to everyone presenting with indicator conditions. As most here are probably aware, there are three broad categories of indicator conditions. Those that are age-defining, those with an undiagnosed HIV prevalence of more than 0.1%, and then the category of diseases, including those conditions where undiagnosed infection poses a significant risk to successful management. So the HEIGHT study has informed category 2A, and many here in the audience contributed to that study. In the HIDE study, an HIV test was offered to all patients presenting to care of specific conditions that you can see on this slide. And the primary endpoint was HIV prevalence. So breaking this down into separate indicator conditions, you can see those conditions to the left of the line here meeting the definition of being an indicator disease condition, with many of the conditions with a much higher than 0.1 prevalence. So there was a small number of both patients and events in the three conditions to the right, and therefore more data is required to classify them as an indicator condition. So the challenge of implementing this is, of course, that people with most of these conditions are presenting in primary care and other parts of the healthcare system not so used to handle HIV, and where many barriers exist. So insufficient time, competing clinical priorities, lack of knowledge, perceived lack of competency, and counseling requirements. And also that patients are not perceived to be at risk, and inadequate reimbursement. To show some results of this strategy, this shows the testing offer at baseline in the UP-test project that ran from 2014 to 2017 for patients presenting with hepatitis, pneumonia, and mononucleosis-like illness. And this shows the change in testing after the introduction of support tools and training of staff. So with training, incentives, and awareness raising, it has been possible to implement this testing strategy in primary care and in hospital departments, which are not usually involved in testing and with high positivity rates. So this strategy is continued in the Integrate joint action, and this is data from here in Lithuania and from Romania, provided by Raimunda. So working in clinics, testing all STI patients, not only for HIV, but also for HCV, besides testing other indicator conditions in dermatology for HIV and HCV. And as you can see, since February 2019, HCV testing has been added to people presenting with an STI. And I think the improvement is quite remarkable. So the test rate for STI is going from 40% for HIV and below 10% for HCV to 100% in only a couple of months. And with a positivity rate of 0.1% for HIV across the diseases and 0.5% for HCV. And Raimunda will discuss this in more detail at the upcoming EAX conference in Basel. So the outcome of this work stream will be a toolkit adapted to integrated testing in healthcare settings. It will consist of a slide set, a patient information leaflet that you can adapt, a data collection tools, case descriptions, and webinars. Another activity that has been made possible because of Integrate and is building on ongoing work with the European Testing Week that has been running the last week of November since 2015 is an additional testing week introduced in May. This was introduced to further involve hepatitis organizations that had raised the issue that the week was held the week up to World AIDS Day, and also to pilot the feasibility of having 2 different weeks during the year focusing on testing. So here you can see the increase in combined testing activities during testing week, with the 2 spring testing weeks in 2018 and 19 included. And even though the majority of testing week participants are still in Western European countries, there's a consistent growth in the amount of participants in the Eastern region, especially from Ukraine the last couple of years. So from the recently finalized evaluation of the spring week that has just taken place in May, This shows that many organizations also use the weeks to engage in activities different from their daily services. And here are some examples. So extended hours, different activities, outreach activities. And also improved collaborations were reported. So the theme for the November week this year is integrated testing. And the outcome of the work stream in Integrate is an information packet with all testing week materials, with integrated testing messages, indicators for monitoring, and case studies and webinars. And the logo is translated in many languages, and it's possible to post success stories at the website. So I'd like to finalize this presentation by highlighting some of the other ongoing activities being piloted as part of Integrate. As you can see here, there are a number of thematic pilot interventions being implemented by partners and collaborators. Here in Lithuania, there's also a focus on introduction of testing in drug addiction facilities. So I think the main lesson learned from setting these up is that the main barrier to integration is structural. So these diseases are being treated in silos. There's many cases, there are special regulations for the different conditions, and there's a lack of communication. In many countries, community organizations are only allowed to test for HIV. Our partners in the project only have HIV as their mandate. So I think we can all agree that if you go into a prison setting and offer testing for HIV, it would also be beneficial to offer testing for hepatitis. And to take it the other way around, I think there are many opportunities in the many HCV elimination programs to consider integrated testing. So there's also a number of national and regional meetings as part of the Integrate Joint Action, and they have shown quite beneficial and instrumental in putting the topic on the political agenda in the countries and enforcing stakeholder dialogue. So the next meeting coming up is in Italy, in Rome, and with the presence of the Italian Minister of Health in November. And I think this is really showing the importance of collaboration between stakeholders, but also stakeholders involved in the different disease areas. And then finally, I can announce that the next HIV conference will be held in Lisbon in May 2021 under the Portuguese EU presidency. And I'd like to thank all the Integrate partners and to the organizers and for you to staying to the end of the day listening. Thank you.